A simple itch could signal cancer in seniors. Don't ignore this early warning sign. Many people think of an itch as just a minor annoyance, maybe dry skin, an insect bite, or an allergic reaction. But what if that simple itch, especially in older adults, could actually be something far more serious? Today, we're talking about a warning sign that many seniors ignore, a persistent itchy spot that could be an early sign of skin cancer. It's more common than most people think, and catching it early can make all the difference. As we age, our skin naturally becomes thinner and more sensitive. This can make it harder to tell the difference between harmless irritation and something more dangerous. But here's the truth. Not all itches are benign. In fact, dermatologists say that in many older adults, chronic itching in one area, especially without a clear cause, can sometimes be a symptom of skin cancer, such as basal cell carcinoma, squamous cell carcinoma, or even melanoma. So, how do you know if an itch is something to worry about? There are a few key warning signs. The itch doesn't go away. Even after applying lotion or antihistaminic, area becomes red, scaly, or crusty. You notice a new bump, patch, or sore that doesn't help. Spot starts to bleed, ooze, or change shape. It feels tender, painful, or unusually sensitive. These symptoms may seem mild at first, which is why so many people brush them off, especially seniors who are used to occasional dry skin or irritation. But that's the danger. Early-stage skin cancer can look like a harmless rash or a dry patch. It can be flat or slightly raised, and the itch may come and go, making it even easier to ignore. One of the most common types of skin cancer in seniors is basal cell carcinoma. It often appears on sun-exposed areas like the face, ears, neck, and arms. It may look like a small pink or flesh-colored bump, and in some cases, it itches persistently. If caught early, it's highly treatable, but if left untreated, it can grow deeper and affect surrounding tissue. Squamous cell carcinoma is another common type, often appearing as a rough, scaly patch or sore that doesn't heal. It's more aggressive than basal cell carcinoma and can spread if ignored. And then there's melanoma, the most dangerous form of skin cancer. While it's less common, melanoma can develop from an existing mole or as a new spot entirely. That mole begins to itch, change color, or grow rapidly. It's time to see a doctor immediately. Now here's the good news. When detected early, most skin cancers can be successfully treated. That's why awareness is so important, especially for seniors who may not notice small changes in their skin or may attribute them to aging. Here's what you can do to protect yourself or a loved one. Check your skin regularly. Once a month, do a full-body skin check, including hard-to-see areas like your back, scalp, and behind your ears. Use a mirror or ask for help if needed. Look for changes. Any new spot, itch, bump, or sore that doesn't go away after a few weeks should be examined. Protect your skin from the sun. Even in your senior years, UV exposure is a major risk factor. Wear sunscreen, hats, and long sleeves when outdoors. See a dermatologist annually, even if nothing seems wrong. Routine checkups can catch signs you might miss. Many seniors live with undiagnosed skin cancer simply because they didn't know what to look for. So if you or someone you care about has a spot that won't stop itching, especially if it's new, persistent, or changing, don't ignore it. It might just be dry skin, but it could also be the earliest warning sign of something much more serious. Taking a few minutes to check could save your life or the life of someone you love. Let's now take a closer look at why seniors are more vulnerable to skin cancer and why early detection call. NB life-saving. As we age, our immune system becomes less efficient at repairing DNA damage caused by the sun and environmental factors. This means that the cumulative effects of decades of sun exposure begin to catch up. Even those who didn't spend a lot of time sunbathing or working outdoors are still at risk because UV damage builds slowly and silently over the years. Skin that has been exposed to sunlight repeatedly, like the face, neck, arms, and hands, is more likely to develop abnormalities over time. Another important factor is that seniors often take medications that can make their skin more sensitive. Certain drugs for blood pressure, cholesterol, or arthritis can thin the skin or make it more prone to irritation and sunburn, increasing cancer risk even more. That's why it's especially critical for older adults to be vigilant about any unusual changes in their skin, including itchiness, texture changes, and new growths. Unfortunately, many seniors delay seeking help for skin issues. Some may believe the symptoms are part of normal aging, while others might not notice them at all due to reduced sensation or mobility. It's also common for seniors to dismiss skin issues as cosmetic or non-serious, especially if they aren't painful. This delay in diagnosis can allow cancer to progress to more advanced stages, which can be harder to treat and may even spread to other organs. But the reality is, skin cancer is one of the most treatable cancers when caught early. Basal cell and squamous cell carcinomas can often be removed completely with minor surgical procedures, topical treatments, or light-based therapies. Even melanoma, when detected early, has a high survival rate with prompt and appropriate treatment. That's why paying attention to the body's signals, even something as seemingly trivial as an itchy spot, can make a life-saving difference. So what should you do if you notice a persistent itch or new skin spot? First, don't panic, but don't ignore it either. Monitor the area closely. Take clear photos over the course of a few days to track changes. If the spot itches continuously, becomes inflamed, changes in size, or starts to bleed or crust, schedule an appointment with a dermatologist as soon as possible. If you're a caregiver for a senior, help them with skin checks and speak up if you notice something concerning. Also consider your personal and family history. If you've had skin cancer in the past, or have close relatives who've had melanoma or other types of skin cancer, your risk is significantly higher. You may need more frequent skin exams and should be extra cautious about any skin changes, including itching. Here are a few additional tips for prevention and protection. Avoid going outdoors during peak sun hours, typically between 10 a.m. and 4 p.m. when UV radiation is strongest. Apply broad-spectrum sunscreen with an SPF of 30 or higher every day, even on cloudy days or when staying indoors near windows. Wear wide-brimmed hats, UV protective clothing, and sunglasses when outside. Stay hydrated and moisturize your skin regularly to reduce dryness and irritation, which can sometimes mask more serious issues. Be proactive. Ask your healthcare provider to perform a skin check during your annual physical, or request a referral to a dermatologist if you're concerned. The bottom line is this: an itch may be nothing, or it may be the first sign of something that needs immediate attention. The cost of ignoring it could be high, but the benefit of catching it early could be life-saving. Knowledge, awareness, and timely action are your best defense. Share this information with your loved ones. Talk to your doctor about regular skin checks And remember, your body often gives you quiet warnings. All you need to do is listen. Let's now talk about the emotional and psychological impact of receiving a skin cancer diagnosis, especially for seniors, and why support and awareness play a crucial role during and after treatment. Hearing the word cancer can be terrifying. At any age, for older adults, the fear may be compounded by concerns about their ability to heal, their independence, or the possibility of being a burden on others. In many cases, seniors may downplay symptoms or avoid medical appointments simply because they're afraid of what they might find out. This is especially true when the symptom seems minor, like a persistent itch. But it's important to remember that early detection doesn't just improve survival rates, it also makes the treatment process easier, less invasive, and less emotionally taxing. When caught early, skin cancer can often be removed in a single outpatient visit, without the need for chemotherapy or radiation. The recovery is generally quick, with minimal disruption to daily life. Knowing this can offer a sense of control and reduce the fear that often keeps people from seeking help in the first place. Still, being diagnosed with skin cancer, even in its early stages, can bring a wave of emotion: shock, denial, anxiety, sadness, and even guilt. Some seniors might feel embarrassed that they didn't catch the symptoms sooner. Others may worry about scarring or visible changes to their appearance, particularly if the cancer is on the face, neck, or hands. That's why emotional support is just as important as medical treatment. Family members, caregivers, and healthcare providers should be attentive not only to the physical aspects of skin cancer but also to the patient's mental well-being. Open conversations, reassurance, and compassion go a long way in helping seniors cope with the diagnosis. Joining support groups, whether in person or online, can also help reduce feelings of isolation and provide a safe space to share experiences and learn from others who have faced similar challenges. Let's not forget the importance of follow-up care. Once a person has been diagnosed and treated for skin cancer, regular skin exams become even more critical. Seniors who've had one type of skin cancer are at higher risk of developing another. Doctors usually recommend full-body skin checks every 6 to 12 months after a diagnosis, depending on the type and severity of the cancer. It's also vital to maintain a healthy lifestyle to support the body's ability to heal and reduce future risk. This includes eating a nutrient-rich diet high in antioxidants, which may help protect skin cells from further damage, as staying physically active to support circulation, immunity, and overall wellness, keeping the skin moisturized to maintain its barrier function and reduce irritation, managing chronic conditions like diabetes, high blood pressure, and autoimmune diseases, all of which can complicate recovery if not well controlled. For caregivers and adult children of aging parents, this is a call to be proactive. Help your loved ones book regular skin checks, offer to accompany them to appointments, ask questions, take notes, and encourage them to follow through on treatments. Sometimes, just knowing someone else is paying attention can make a big difference in whether or not they take action. Public awareness also has a powerful ripple effect. When we share stories, whether it's about an itchy spot that turned out to be cancer or a quick visit that led to early treatment, we help others become more alert and informed. We break the stigma around skin cancer and make it easier for people to talk about their health without fear or shame. In conclusion, what may start as a simple itch can become a life-altering diagnosis, but it doesn't have to be a life-ending one. Seniors deserve the best chance at healthy aging, and that means paying attention to every symptom, no matter how small: an itchy spot, a changing mole, a sore that won't heal. These are not signs to ignore. They are signals to act. Empower yourself and your loved ones by staying informed, taking preventive steps, and never dismissing what your body is trying to tell you. Skin cancer is one of the most visible, most treatable forms of cancer when caught early. That means the power to change the outcome is literally in your hands. Your skin is your first line of defense. Treat it with the care and attention it deserves, because your health, your independence, and your life are worth it.